Did you know that routine infant circumcision is the only procedure performed regularly at birth in America as a prophylactic or preventative measure? No other body part is normally removed at birth for no immediate medical need. This issue should concern you because there's a high chance you were circumcised at birth, or you will have to make the decision to circumcise another human being in your life, and you should go into this decision with all the information available. Routine infant circumcision should be banned. To illustrate this, we'll look at how circumcision is not ethical because all humans deserve bodily autonomy, how most industrialized nations do not practice circumcision, and how circumcision has unnecessary risks. Firstly, circumcision is not ethical because all humans deserve bodily autonomy. Bodily autonomy is the concept that every person has the right to control what does and does not happen to our bodies. Before adulthood, parents can make medical decisions on their child's behalf if it is considered in the child's best interest. This responsibility is normally not taken lightly by parents, but within certain cultural conditions, cognitive dissonance can make us blind. So I want to open up your minds to a practice that you probably have not considered beyond the fact that it is normal and it's just what's done. The foreskin is not a birth defect. It's a normal, healthy, and functioning part of the human body that is present in both males and females. The female foreskin is also known as the clitoral hood and covers the female equivalent of the glands of the penis, which is the clitoris. The human body is made exactly the way it's supposed to be, honed over 6 million years of human evolution for optimal reproductive success. Of all the things that you'd think would be perfected, it would be human genitalia, which is the exact equipment used to reproduce. If our genitalia wasn't working the way it was intended to, we could not succeed as a species. In fact, the foreskin is not only seen in both male and female humans, but also every mammal on this earth. It would not make sense that out of every mammal on this planet, only human males have body parts that need to be removed at birth for medical reasons. Next, most industrialized nations do not practice circumcision. In this, America stands alone. If circumcision was as necessary for every newborn male as it was made out to be in America, you'd see large rates of penile issues in the industrialized nations that do not practice circumcision regularly. But you do not. Our neighbors in Canada above us have a 32% circumcision rate, with our neighbors in Mexico below us having only a 15% circumcision rate. Across the ocean over in the UK, you'll see a 21% rate. You do not hear Europeans frequently complaining about UTIs, penile cancer, HIV, or cleanliness, because those issues are incredibly minor for Western societies. Most Americans do not do it for medical reasons. They do it for perceived cultural benefits like fitting in with their peers and matching their father. However, a part of a person's body should not be cut off because of a fear of ridicule. Rather, we should be accepting of our children's bodies the way that they are born. In some cultures, female circumcision, also known as female genital cutting, is commonplace. In our Western societies, this is considered barbaric, yet it continues to be perpetuated for very similar cultural reasons. The women of those cultures believe the clitoris to be dirty and vulgar. They believe a woman would not be able to find a husband if she wasn't cut. Their daughters would be outcasts, so they continue holding them down and cutting them. Generation after generation, these traditions continue without a second thought. Most Americans also have many misconceptions and fears about the male foreskin that are deeply ingrained in our society, which aren't seen in other parts of the world. They believe the foreskin to be a breeding ground for bacteria and diseases that would cause huge issues growing up, like rampant infections. They also believe they're doing their sons a favor, as it would be difficult to clean. The reality is that the foreskin is just a layer of skin over the glands of the penis and isn't any harder to clean than a vulva, which has numerous folds. In a study in the Journal of Urology, published in June 2013 by Brian J. Morris and Thomas E. Wiswell, they found that the lifetime risk of UTIs in uncircumcised or intact males is 23.3% chance. In a study published in the Sultan Qaboos University Medical Journal on August 13, 2013 by Ahmed Al-Badir and Gadir Al-Sheikh, they found that around 50 to 60% of women will develop UTIs in their lifetime. So although the risk for UTIs might be decreased with circumcision, it's still less than the risk of UTIs in women. And UTIs are not a huge issue to begin with. As a woman, when we get a UTI, we simply go to the doctor and get antibiotics because it is a normal infection with small risk, and we have medicine to clean the infection up. We don't seek to remove folds of the skin of our genitals because of minor infections that we might possibly contract in our lifetime. Finally, there are unnecessary risks with circumcision. One risk is death. Although the risk is extremely low, it is still an unnecessary risk to take to potentially lose your newborn at birth for cosmetic reasons. In the American Journal of Perinatology reports in November 2012, a study published by Nino Solomonia and colleagues found that infants can die from blood loss of less than 30 milliliters, which is approximately 1 ounce of blood. One study published in the Thymos Journal of Boyhood Studies by Dan Bollinger in April 2010 has estimated that more than 100 neonatal circumcision-related deaths occur annually in the United States, which account for 1.3% of male neonatal deaths from all causes. There's also a loss of sexual sensitivity. Since the penis is a highly erogenous reproductive organ, obviously with tissue loss, there will be loss of sensitivity as well. In the British Journal of Urology International, published in April 2007, a study by Morris L. Sorrells and Associates concluded that the glands of the circumcised penis is less sensitive to fine touch than the glands of the uncircumcised penis, also stating that circumcision removes the most sensitive parts of the penis. There is also significant loss of penile tissue. When you remove a tiny bit of skin from a newborn baby, you probably aren't envisioning how the skin will grow and how much tissue the adult foreskin actually is. Also published in the British Journal of Urology in February 1996, a study by J.R. Taylor and Associates found that the amount of tissue loss estimated in their study was more than most parents understood, even after the preoperative counseling. They also found that circumcision removes skin that appears to be an important component of the overall sensory mechanism of the human penis. In a study by John Warren, published in the book Genital Autonomy in August 2010, he said that male circumcision results in the loss of 30 to 50% of penile skin and the loss of at least 10 to 20,000 specialized erotogenic nerve endings. In conclusion, routine infant circumcision should be banned. Circumcision is a medical procedure that should only be performed when a medical issue arises that requires it. To illustrate this, we looked at how circumcision is not ethical because all humans deserve bodily autonomy, how most industrialized nations do not practice circumcision, and how circumcision has unnecessary risks. Since most circumcision done in the United States is done for cultural and social reasons, we have to ask ourselves, is strapping down a healthy newborn at birth to cut a part of their body, risking their life so that they can fit in with their family and peers, actually ethical? Between cultural practices like female genital cutting, which can have huge risks and consequences and little to no health benefits, to male genital cutting, which has minor risks and minor health benefits, to piercing babies' ears, which is relatively harmless and has no health benefits. Should parents be allowed to make any of these irreversible decisions regarding their infants' bodies? No. Parents should not be allowed to change their child's bodies because they think something looks better. Every person should be able to make these decisions about their own bodies. If your son wants to be circumcised for social reasons, he can make that decision on his own as an adult. If your son doesn't want to be circumcised, he can never get his foreskin back. For that reason, I think circumcision as a cultural practice should be banned.